Waking up with back pain and stiffness can totally ruin your day. In this video, I'm going to teach you a simple routine based on motor control and stabilization principles. I know that sounds kind of scientific, but it's supported by research to help you get going early in the morning. Okay, so after 28 years of treating low back pain, I've noticed something. My patients who start their day with some intentional movement to help their low back, they tend to have fewer flare-ups and they function better throughout the day. So what can you learn from my patients and my experience to help you kickstart your day if you are having some back pain issues? So first of all, we got to talk a little bit about motor control. Motor control is basically the fancy word that scientists use to talk about how those muscles act together in coordinated type efforts. Motor control activity and exercises for the low back, and especially for low back pain, they tend to target the deep trunk muscles like the transverse abdominis and the multifidus, while minimizing the overactive rectus abdominis and erector spinae muscles. So if you've ever felt in your low back and you feel like those muscles are like really stiff and tight, like cable cords back there, those are your paraspinals. Those are the erector spinae. Those muscles are overactive, and it's usually a good sign that the deeper stabilizing muscles are less active. So our goal is to really help to coordinate the activity of those muscles to help stabilize your spine and pelvis. So this isn't muscle building, bulking up. This is about how to retrain your core muscles, the deep muscles close to your spine that are going to help with your back pain, teaching them how to work together. So we will have some breakout exercise clips where you can kind of see how these are performed, but a couple of things you can do first thing in the morning. Now, again, these are generic. They tend to work for most patients. However, you have to use common sense. And if this does feel like it's irritating your back or making things worse, please stop and consult with your physical therapist or someone else that you may be seeing for your low back pain. So the first one is a pelvic tilt. Very gently, you're just lying on your back and your knees are bent, and you're very gently rocking your pelvis kind of backwards and forward to kind of grease the groove, to kind of get that pelvis moving a little bit. But as you do, as you roll that pelvis backwards just a little bit, you're activating some of those deeper core muscles, which is what we want. You can go just 10 reps, 30, 40 seconds. It's not a lot. We're just trying to kind of prime the pump early in the morning. We're not doing these things to maximum all-out activity. The second one that's great to kind of loosen up the spine is a cat-cow maneuver. Basically, you're on hands and knees on the floor or on your bed. That's fine. And you just kind of arch your back up and back down, up and back down. Again, we're rounding the spine and then we're reversing that curve. And that's just to get those joints moving back and forth nice and easy. 8 to 10 reps is perfect. That's all you need to do. Now, on your back again, you can also do a single knee to chest. If those hips are a little bit stiff, you're gently going to bring one knee up towards your chest while you keep the other knee out straight. That'll help to stretch on the opposite side hip flexor, which in most people is very stiff because of the amount of time we spend sitting throughout the day, whether that's driving to work and then you sit for 8 hours and turn around and drive home. Most of us sit way too much and our hip flexors get way too tight. If you're finding this video helpful, please make sure you like, share, and comment below. Also, don't forget to subscribe for future content. Okay, exercise number 4, the dead bug. No, we're not squashing bugs around the house. We're actually laying on our back with our hands and legs up towards the air. And you can do different variations of this one. You can use arm-only type activities. You can do leg-only activities, or the combination of your arms and legs together. The key is you want to make sure you're locking in your core muscles and you're stabilizing your trunk and not letting your back overarch, which can increase the back pain. Again, you can do anywhere from 6 to 10 repetitions per side. And finally, exercise number 5 is the bridge. This is laying on your back, and you're going to tighten your abdominal muscles as you push to lift your hips up off of the table or off the bed. That's fine. The key here is that you're engaging those core muscles, and you're also using your glute muscles to help you lift up. If you feel like you're getting cramps in your hamstring, that tells us you're using your hamstrings over your gluteal muscles. So try to really squeeze your butt before you start to lift up, and that'll ensure that you're using the proper muscles for that exercise. About 8 to 10 repetitions just to start off with. Okay, let's talk about realistic time frames. So if you're not doing anything and maybe you're having a little bit of back pain or even no pain at all, just start very gentle, right? So weeks 1 and 2, really just kind of focus on learning the form. They may feel a little bit strange or awkward, but just start to do them. Just get used to doing the patterns. Then by weeks 3 and 4, you should start feeling a little bit more comfortable and coordinated. That is the motor control aspect. Your body is learning how to move, how to do these new moves. And then between weeks 6 and 8, you should feel improvements in the overall morning stiffness and pain that you have throughout the day. So it does take some time, but you have to be consistent. That is the key. If you don't stick with it for the first 2 to 3 weeks, then you're going to more than likely drop off and you're not going to see the full benefit. Okay, so remember, it's not about perfection. It's about showing up every day to help your back. Now, your call to action here. I want you to start tomorrow morning. Okay, practice these exercises. You can download the card that we're going to put down here for you to take a look and have those exercises on there. And now, what does the research say regarding low back pain and exercises? So there's several systematic reviews. Basically, that means they take a bunch of studies and they kind of look at them and see what all fits together. And they found overall that motor control type exercises, the ones that we just discussed, they work very effectively for improving pain and disability in patients with low back pain, what they call non-specific low back pain, meaning they're not exactly sure which tissues in the low back are causing problems. And so a lot of times stabilization, spinal stabilization exercises is the way to go with that. For patients that have chronic low back pain, you've had it for long periods of time, again, motor control exercises show effectiveness for reducing pain and improving overall function. In a prior video, I talked about this and the fear avoidance behavior. So that links into patients that have chronic back pain. They have that fear avoidance behavior, so they stop doing activities, but they also stop trying to do stabilization exercises, which is what you need to do. Now, regular stretching and strengthening exercises can also help prevent episodic back pain or that recurring back pain that we've talked about in the past. But you have to do it on a regular basis. So consistency is the key, and you need to go slow and cautious to start off with. So overall, the exercises themselves are not magical. There's nothing special about those 5 exercises that we just talked about. They're usually easy to do. Most people can get them. You can do them. You can do them from the safety of your house, and they're relatively benign, meaning they should not increase your back pain. What matters most is that you're doing them consistently. Okay, you can do these daily, and you're going to be perfectly safe, which is what I recommend, doing them daily. That'll help stave off future episodes of back pain and help keep your back feeling great throughout the day. And again, like I said, comment below, what's the biggest challenge? What kind of issues are you facing with your back? Which exercise is easy? Which one is hard? And let me know. Also, as I said in the early part of the video, if any of these exercises or anything you're doing is causing sharp stabbing pains, symptoms that are shooting down your legs, you must stop and talk with your physical therapist or your doctor about this. So the routine here is designed for just general back pain management and not for any specific diagnosed condition. So please have a great day and let me know how else we can help. Have a good one.